Hi, this is JP Hong from Seoul, Korea, and today I want to discuss you about the recent publication that was published in Archives of Plastic Surgery. This publication talks about the theoretic basis of treating dementia from a lymphedema perspective. And only very recently, until a decade ago, the brain is now proven to have a lymphatic system. And ultimately, the metabolites from the brain is actually drained to the lymphatic system and then drained through the deep cervical system and then ultimately to the heart. Now, taking that in mind, the hypothesis that we made was if we're able to create a shunt that allows to increase the drainage of the lymphatic system of the brain, then perhaps maybe this can help the dementia patient. Another hypothesis that needs to be proven is the fact that dementia is a cause from a potential obstruction or a dysfunction of the lymphatic system, which it ultimately drains to the deep cervical nodes. And there are multiple indirect evidence from the Taiwanese group showing that there is increased risk of dementia in bilateral cervical neck dissection patients, as well as our recent study which looks into the anatomy structure of the deep lymphatic system using an ultra-high frequency ultrasound, and it does show that there is a significant difference among the normal and the dementia patient group. So that taken into account, we do believe that there is a potential, if we do increase the drainage of the lymphatic system that drains the brain, that perhaps that we will be able to increase the metabolites clearance and ultimately improve dementia. And the good news is that the Chinese colleagues have actually done this and have shown that in some patients it works almost instantaneously to improve not only the motor but the cognitive function of the patient suffering from dementia. So now we're living in a very exciting period. And of course, this is just the beginning. Perhaps we don't know what the perfect solution is. And I believe that this might be one of the modalities to improve the patient suffering from dementia. But nevertheless, this is a journey that's just begun and is exciting journey, and proving these hypotheses and hopefully finding a potential improving solution to dementia is what this paper talks about. So please do not hesitate, and please read the Archives of Plastic Surgery March issue, which is talking about the theoretical basis of the surgical approach behind improving dementia. Thank you very much.